And so looking at the answers here, so here's our normal curve, right? We've got depolarization, repolarization, slightly hyperpolarization, and then back to rest. With TEA, we see nicely depolarization happens normally with TEA, but then we don't have that peak and then that repolarization happening, soon thereafter. In fact, we see the lingering of the membrane potential quite positive, and then eventually it kind of trickles off back down to rest as the leak channels remove some of the sodium, as the sodium potassium pumps remove some of that, reestablish equilibrium as well. TTX is, again, very straightforward. There's no activity, there's no curve, there's no membrane potential change because the voltage-gated sodium channels are synonymous with the initiation of the action potential. And if they're blocked, then everything's blocked, okay? Now, which of these two do you think would be more lethal? Just kind of looking at this and taking both of those things into account. Which one would be more immediately lethal?
TTX.
Excellent, thank you, the TTX, right? If we see a flat line, right, in other vitals, that's trouble too, but here in terms of the action potential, that is definitely indicative of trouble, that is lethal. If we don't have our neurons generating action potentials, we can't excite muscles, we can't breathe. Okay, so this is going to be immediately lethal, whereas TEA does have some time. It can become fatal, but there is still some time where we can introduce other compounds that would combat this. We can, get these patients to a ventilator, things like that. And so there is some time. This is not as immediately lethal as the pufferfish toxin, as TTX, okay? So just a bit of a clinical correlation or a real life correlation to how important our action potentials are in terms of sending those signals of communication between our neurons and other excitable cells, mainly muscles, okay? Moving on to our third objective, we're going to now speak about putting this together and thinking about our refractory periods, both absolute and relative, and talking about their significance in terms of describing the properties of an action potential. So we've got two different refractory periods, right? These are basically periods where it is impossible, or in the case of a relative, it is harder to fire another action potential, okay? And so it's gonna be a period immediately following one action potential, and that is divided into two different periods. So we've got the absolute refractory period. This is occurring during an action potential, as well as immediately after those sodium channels have become inactivated, okay? So this is essentially this proximal part, or the proximal region of the action potential. And so if we think about the state of our gates on the sodium channels, when the activation gates are open, but the inactivation gates are closed, this is because the membrane potential has not been restored to rest. And this is because we are still in the process of firing one action potential, essentially. And so irregardless of the strength of a following stimulus, we can, excuse me, sorry. Irregardless of the strength of a following stimulus, we cannot get to threshold, we cannot overcome the inactivation gates, and we cannot fire another action potential, okay? So really important to understand that the channels here are not just closed, but they are inactivated. They are closed and incapable of being open. The relative refractory period is beyond that time. So this is a time where we now see some activation or opening up of our inactivation gate, excuse me. The membrane potential is getting back toward rest. And so the activation gates on our channels are now closed. This is our sodium channels. Activation gates are now closed, but the inactivation gates are now opening. So quite a few of our channels are able to incite another action potential, but it's going to be much harder. Why is it going to be much harder? Because we still have the movement of potassium, okay? So potassium is still The channels are still actively trying to close. Remember, the hyperpolarization stage is when we still have a few potassium channels actively trying to close as we restore that resting membrane potential as we get into that hyperpolarization. And so we could potentially fire another action potential, but it's going to require a very strong stimulus to overcome that more negative state of the membrane potential. And if you think about it, when we start an initial action potential here, we're going from -70 to -55. And so a stimulus of that magnitude will incite or initiate one action potential. But if we're in our relative refractory period, here we're going from an even more negative state, about -85, all the way up to -55. And so we're going to need a stronger stimulus during the relative refractory period. But if we did get a stronger stimulus, the state of the sodium channels is such that we could potentially initiate another action potential. Okay, and so based upon these events and this period, these two periods, the absolute refractory period and the relative refractory period, we can describe the action potential as being a separate all or none event. We can also describe the action potential as being unidirectional. Okay, in other words, when the action potential is being propagated down the length of the neuron, the period, the area of the neuron that is in its absolute refractory period cannot initiate another action potential. And so the action potential can only spread in one direction, right? It's going to be in the direction of the area that can be excited because it is now at rest, okay? And so I said all of that to say that the absolute and relative refractory periods help to keep the action potential moving in one direction and not moving in the opposite direction or backward. So here's another view or another perspective of these refractory periods. So the absolute refractory period we said spans all of depolarization and most of repolarization. So it's going to be during the actual action potential of that first segment. So we fire a stimulus here. We depolarize this part of the neuron, okay? We have that upward or upstroke of the membrane potential. That is due to the opening up of our sodium channels. And then as these sodium channels begin closing, that is going to be our absolute refractory period. Our relative refractory period is going to be the last part of repolarization. And I really want you to understand why it is possible for another action potential to be started here, because we now have the sodium channels reconverted to their initial state, where they're in that resting phase, where the activation gates are closed, but the inactivation gates are open. And so although a stronger stimulus will be required, a stimulus would be able to open up the sodium channels because the inactivation gates are open, okay? And so a second action potential could be generated here. It's gonna need to be stronger, taking into account that we also still have some residual movement of potassium. And so the membrane potential is really negative in this stage. And so a stronger stimulus would be needed to go from -55 to our threshold, and then we could potentially fire another action potential. Okay. And so again, thinking about the state of our sodium gates in the relative refractory period, some of them are closed, and closed here means that they are closed but capable of opening. And some of them are inactivated. And again, inactivated means that they are closed but incapable of being opened. Okay, so because the majority of them are just closed, right, they can be opened, we can fire another action potential here. All right. So we're going to pause briefly here, look at a few checkpoint questions, and then we will keep going along. So the first question, can an action potential be generated during the absolute refractory period? And then can it be generated during the relative refractory period? And then more importantly, kind of the why to these two.
It can't happen during the absolute refractory period because the sodium channels are incapable, all of them are incapable of opening, so you can't have that action potential. But then during the relative refractory period, some of them are closed, but then some of them are capable of opening. And so then you will need that stronger action potential, but it can occur there.
Excellent. Well said. Perfect. So again, absolute refractory period, we cannot. They're all closed and incapable of opening. In other words, they're inactivated. That's what that inactivated means. And then during relative, we could, stronger stimulus would be needed because most of them are closed but capable of opening. And then a few of them are still closed but incapable. We could potentially get to threshold in that state. Okay, excellent. And then the second question here, during the absolute refractory period, are the majority of sodium channels open? Are they closed but capable of opening? Or are they closed and incapable of opening? So what is the state of the majority of our sodium channels during the absolute refractory period? Any thoughts here?
The majority of the I would say all of the sodium channels are closed and incapable of opening, but not all the potassium channels are, which means that if there is a strong stimulus, sorry about that. If there's a strong stimulus, it can open, but the sodium channels are incapable of opening.
Excellent. Well said as well. Perfect. So again, the majority of them are closed and incapable of opening. Okay, so they are inactivated. And again, we're asking here specifically about that absolute refractory period. But then, although they are in this state, we also have, right, so we've got the closed and capable of opening, and then the relative refractory period, they're actually going to be closed but capable of opening. And then we've got the movement of potassium sort of combating that. So the correct response or correct choice here would have been that final choice, closed